new C Walkart Hello Dotor, brought to you by Walkart Hospitals, enhancing quality of life.
नमस्कार. हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक येवकार. हॅलो दोतोर कार्यावळीन आज आमचे बरोबर आसात डॉक्टर पारुल दुबे, न्यूरोलॉजी कन्सल्टंट. म्हणजे ज्या भुरग्यांक ल्हानपणार किंवा जाणट्यांक सुद्दां मोडण्याचें दुयेंस किंवा एपिलेप्सी मारून येवप किंवा जाका पॅरलायसीस जाला म्हणजे एक सायड पांगडी पडल्या जाका आमी आरीचें दुयेंस म्हणटा किंवा मायग्रेन हेडेक किंवा आनी ह्या सारकिले जे तुमचे प्रश्न आसात ते तुमच्यान आमी विचारूं येता. आनी ही आसा आयच्या दोतोराची वळख.
डॉक्टर पारुल दुबेन MBBSचे शिक्षण मिळवून MD जनरल मेडिसिनची पदवी 2006 सालान गांधी मेडिकल कॉलेज आणि हमीदिया हॉस्पिटल भोपाळच्यान मेळयली. तसेच तिणे DM न्यूरोलॉजीचे शिक्षण 2010 सालान SMS मेडिकल कॉलेज आणि बांगूर मेडिकल रिसर्च सेंटर जयपूरच्यान घेतले. बऱ्याच हॉस्पिटलांनी काम करून सध्या दोतोर दुबे गोवा मेडिकल कॉलेजीन न्यूरोलॉजी कन्सल्टंट म्हणून प्रॅक्टिस करतात.
वेलकम डॉक्टर. नमस्कार.
नमस्कार.
दुसरी एक महत्वाची गजाल म्हणजे तुमच्यानी कोंकणीन प्रश्न विचारता डॉक्टर इंग्लिशीन आन्सर करतले, हांव इंटरप्रेट करपाचो प्रयत्न करता. हिंदीने ते उलोवंक शकतात. तुमचे प्रश्न मुजरत विचारात. जशें हांवें सांगलां की हेडेक, मायग्रेन हेडेक किंवा एपिलेप्सी किंवा स्ट्रोक, आरीचे दुयेंस ह्या संबंधित विशयाले प्रश्न तुमच्यानी विचारूं येता. हातपाय मोयेतात किंवा ह्या सारकी सुद्दां जी दुयेंसां आसात तांचे विशीं विचारूं येता. डॉक्टर, जस्ट टू स्टार्ट द शो, first let me ask you a very common question. Most of the people, they get migraine headache. What is the difference between this migraine headache and other type of headache, and when you should really take this matter seriously? Because often sometimes people think that this is just a migraine headache and we may miss some important underlying pathology. So which are your yardsticks? Then okay, this is a time we should really take this a little seriously.
See,
or in general you can talk about a headache. You can start with.
As you said, migraine headaches are very common.
Yeah.
And they are one of the non-serious variety of headaches.
Correct.
There are particular criteria according to which we decide that it is a migraine headache. Like if the headache is unilateral on one side of the head, it is of a pulsatile throbbing variety associated with nausea and vomitings, and it's quite disabling. It's quite severe.
Yeah.
Like the patient has to rest at that time and prefers not to move around. And this headache is occurring again and again on a recurrent basis, usually in young females, also in males. And if there is a family history of similar headache, we would label it as a migraine headache. And it is one of the primary headache variety, which means that if you image the brain, you do the scanning of the brain and all, you will find everything is absolutely normal. So it is not a serious variety, but it is a very disabling kind of headache. But there's certain headaches, as you asking me, like when we should be concerned, which headache should make you concerned. If a very severe headache has occurred for the first time in the life of a patient, and it is the worst ever headache he had in his life, I would be concerned.
Okay.
If a severe headache has occurred in an elderly patient, that is a matter of concern. Headache occurring in the setting of fever, headache with fits, headache with any visual disturbances, all those would be matters of concern.
Matters of concern. Thank you, doctor. Doctor, I think we have got a question. Hello.
हॅलो डॉक्टर.
नमस्कार.
माझा प्रश्न असा आसा तुमकां की आमी न्यूरोलॉजिस्टा कडेन वचपाचें आमी केन्ना ठरोवपाचें, कारण पेन्स ड्यू टू जॉइंट पेन और एनी अदर पेन्स, हाऊ टू डिफरन्शिएट, दॅट इज वन क्वेश्चन.
नाही मातशे मोठ्या विचारात.
हॅलो.
हां.
माझो प्रश्न असो आसा की न्यूरोलॉजिस्टा कडेन आमी वचपाचें आमी केन्ना ठरोवपाचें, कारण जॉइंट पेनाचे पेन किंवा दुसरे पेन आणि न्यूरोलॉजी डिसऑर्डराक लागून जे पेन जाता हे आमी.
नाही न्यूरोलॉजिस्टकडे पेन म्हणजे जसे आम्ही उलयले की मायग्रेन हेडेक जसे डॉक्टरांनी सांगले की सामके सिव्हिअर आसा, खूप म्हणजे डिझेबलिंग आसा, जाल्यार वचूं येता. किंवा जेन्ना तुमकां अशें स्ट्रोक किंवा पॅरलिसीस जाता तेन्ना एक्चुअली कशें आसा, न्यूरोलॉजिस्ट इज एक्सपर्ट पर्सन इन दॅट फील्ड. जनरल फिजिशियन सुद्धा सगळे मॅनेज करतातच, पण न्यूरोलॉजिस्ट हो ताचे सामको अतिशय तज्ञ असता. इट इज सुपर स्पेशलायझेशन. आणि त्या विशयातले जे प्रश्न असतात ते तुमच्यानी विचार येतात. प्रश्न विचारात.
न्यूरोलॉजिकल डिसऑर्डर प्लीज.
हय,
त्याच्यावर मातशें सांगल्यार बरें.
द क्वेश्चन इज, वेन a general person should feel that should go to the neurologist, like under which
Okay.
conditions?
Okay. So the question is like,
yeah.
what are neurological disorders?
Correct, in short, yeah.
Okay. So
In
neurological.
short, you can answer.
Yeah, neurological disorders are disorders concerned with the brain,
Yeah.
the spinal cord,
Correct.
and the peripheral nerves, muscle. Okay. So headaches, seizures, strokes, peripheral neuropathies, in which patient has difficulty in
Feeling the sensations.
feeling the sensation,
Yeah.
or weakness in all four limbs.
Yeah, yeah.
These are the general categories of illnesses. Vertigo, where the person should consult a neurologist.
बरोबर. म्हणजे डॉक्टर सांगला जाका परत परत घोळ येतात, जेन्ना ताका डिप्लोपा डबल दिसता किंवा अशे हात पाय सामके फुडें मुयेतात किंवा ताका धरू शकना, विकनेस आसा, मसल विकनेस आसा, नर्व जेन्ना म्हणजे तकलेंतल्यान कितें तर हेडेक्स खूब सिवियर आसा, स्पायनाचे प्रॉब्लेम आसा, अशा लोकांनी न्युरोलॉजिस्टाचो ओपिनियन घेतल्या फायद्याचें जाता. अशें ह्या प्रश्नाचें उत्तर आशिल्लें. डॉक्टर वी हॅव गॉट अनदर क्वेश्चन. हॅलो.
हॅलो हॅलो
हा.
डॉक्टर गुड इवनिंग हांव तकलेच्यान उलयतालें.
हा.
डॉक्टर म्हाका एक प्रॉब्लेम जाला. म्हाजे तकलीक न्ही मातशें थोडें दुखलेले भशेन जाता आनी कंटिन्यूस दुखता. अशें म्हाका तशें कितें प्रॉब्लेम ना, डायबिटीज बी तशें कितें ना.
हा.
हे 4-5 दीस जाले आतां हांव दुखता खूब म्हाका. हांवें एक ब्रुफी टॅबलेट गेली दुखता म्हणून, थांबलें, परतून दुखू लागलें.
नाही पण नक्की एक्झॅक्टली खंय दुखता?
तकलीर वयर रायट सायडीक
राईट सायडीक दुखता. बरें म्हाका सांगा, अशें तुमकां खूब फावटी फ्रिक्वंटली दुखता काय फर्स्ट टाइम जाला?
ना, फर्स्ट टायमूच जाला आतां.
फर्स्ट टाइम जाला. तुमची एज कितें म्हटली?
50
60
50.
50. आणि तुम्ही काम कितें करता?
टीचर आसा.
टीचर.
टीचर.
Okay, she has
Yeah.
unilateral headache
Yeah, right-sided headache for last 5 to 6 days.
and occurring for the first time.
Yeah. Does she have any nasal discharge or any fever, anything like that?
Nothing like that.
Nothing like that. Okay. See, she's 50.
Yeah.
So, and this is the first time headache.
Yeah.
So it seems a little odd for migraine, but it is almost continuous. So I think she should just consult a physician or a neurologist.
Yeah.
Just to check whether it is some nasal infection or anything, because if it has occurred for the first time and there is nothing more associated with that, then I would take it as a maybe viral illness leading to this headache or something like that.
Okay.
But I will have to take
A review of the case and then
Yes.
examine properly.
Yeah.
No, one more thing which I feel that, as you have rightly said, maybe even some unilateral infection of the sinus also can possible.
Yeah, because this has occurred for the first time.
First time.
Yeah.
So, yeah, okay. Doctor, we were discussing about the headaches, which and you are saying that what is speciality about this migraine headaches? That
Yeah.
they come, you can get a feeling vomiting, then there could be triggering factor.
Yeah.
It can mostly it is unilateral. So one more thing I just want to know: is there any remedy for this headache? Because or there, okay. Before that, I think we have got a call.
Yeah.
Hello.
हॅलो.
Ah,
डॉक्टर हांव प्रिया कामत उलयतां परवरी.
प्रिया बाय, मातशे मोठ्यान प्रश्न विचार.
हॅलो डॉक्टर, म्हजे पांय दुखता.
हा.
1-2 वर्सां जालीं. आतां म्हाका सकाळीं उठलें की उबेच रावपाक जायना, चलपाकूय जायना.
Ah.
आनी बसले उठले की चलपाक जायना. आनी पांयाची पोवटी आसा ती खूब दुखता. अशी रगत चिटचिटना भितर शिरो तशें जाता.
दोनूय पांयान?
हय, दोनूय पांयांक सेम. आनी एक रायट पांय मातसो चड जाता.
हय, पण पांयांक विकनेस आसा, म्हणजे अशक्तपण असो आसा?
ना, तशें कांयच ना. म्हाका चड उबें रावलें तशें चड दुखता, नाजाल्यार मदीं तशें चिटचिटता.
How
Ah.
old are you?
आणि एज कितें तुमची?
एज म्हजी 34.
34. आणि प्रोफेशन?
प्रोफेशन हाऊसवाईफ.
हाऊसवाईफ. म्हणजे मग सकाळी उठल्यारच हे त्रास जाता, मागीर कमी जाता?
मागीर मातशें चललें 10 मिनटां की थारता, पडचें. मागीर 1-2-3 वरां काम जालें म्हजें की 1 म्हणल्यार परतें दुखपाक लागता. म्हणजे अशें की हांव बसचें कशें दिसता म्हाका आनी उबें रावचें.
बरें, आता एक तुमकां सारको महत्वाचो प्रश्न, सारको लक्ष दिवन आयकाता. तुम्ही समज चलता न्हय, जाल्यार तुमकां अशें चलताना मदीं परत म्हणजे रेस्ट घेवन परत चलचें पडटा. अशें इंटरमिटंट क्रॉनिक अशें येता की चल्ल्या परत थोडो रेस्ट घेवन मागीर चलूं शकता, अशें जाता?
हय, मागीर मातशें चललें, बसलें, मातशें चललें की मागीर बरें दिसता.
Is she having a heel pain?
पांयाच्या पोनाक खोटेक दुखता?
हय, खोटो चड दुखता म्हजो.
Yeah,
वयर धोपरा कडेन ती
so-
चड येना पेन. खूपच अशें उबें रावलें जाल्यार मागीर वयर चडटा, नाल्यार सकयलूच चड जाता पेन.
Yeah, if it is a heel pain,
Yeah.
most likely it may be because of a calcium deficiency. Because in ladies, the most common thing that leads to this heel pain is a calcium deficiency. I don't think it would be a neurological pain, because it very characteristically.
Yeah, in fact, it also appears something like ortho, because second thing what is
Yeah.
saying, she's getting more pain in this this area below the knee, and after walking certain distance, she has to take a rest. Again, she can. So it is like an intermittent claudication.
Does she have a back pain also?
Now it is difficult to, because she is out of the line.
Yeah. If she is having a back pain,
Yeah.
and if the pain is kind of shock-like, going from the back down the legs, then possibility is she may be having a lumbar spondylosis as well.
Acha.
And because as you suggested, if the pain comes after walking for some time,
Yeah.
then it can happen because of lumbar spondylosis. But if it happens in the morning and as soon as she puts her foot down on the floor and gets that heel pain, possibility is that is calcium deficiency.
अच्छा. सो आय थिंक एट दीस पॉयंट ऑफ टायम ज्या प्रश्नाला अशें दिसता की तुमकां एखाद्या वेळी घडये कॅल्शियम बी डेफिशियन्सी आसूं येता, आनी म्हाका दिसता ज्या पद्दतीन तुमी सांगलात त्या पद्दतीन म्हाका तुमकां एखादो ऑर्थोपेडिशन तुमी पयलीं कन्सल्ट करा, आनी ताका समज दिसलें की ही पेन नो पेन आसा आनी ताका जर तुमकां एक्सपर्ट ओपिनियन लागतलें जाल्यार डेफिनेटली युअर ऑर्थोपेडिशन मे बी अ बेटर जज फॉर यू टू गायड अकॉर्डिंगली. बरोबर. सो म्हाका दिसता तुमी चड टेन्शन घेवं नाका आणि तुमचे हे बरें जावं शकता. थोडेशे एफर्ट्स दवरपाचे आनी पॉझिटिव्ह थिंकींग करपाचें. हॅलो.
Hello.
हॅलो.
Yeah, hello.
या.
Doctor.
विचारात.
Good evening, doctor. Last time I had a general this thing to you.
Okay.
Yeah.
But, I didn't get that right doctor for neurophysiology. Now I got it, Dr. Parul, huh?
Yes, yes. Yeah.
Yeah, so I had a problem right side, burning sensation.
मागच्या तुम्ही घराकडे टीव्हीचा आवाज कमी करात मस्त.
Yeah,
या. विचारात, प्रश्न विचारात.
yeah, burning sensation I had.
या.
Little is becoming more and more. Right side from head to toe, it is burning.
अच्छा, ओके.
For how long?
या.
For how
For
long?
1 year, almost 1 year.
हा.
I think I met the same doctor, Parul, GMC.
आता okay, now whom you have met is, I told you, you just tell your complaints, wait
Yeah,
for the
yeah.
answer. Whom you have met, we are not interested, just
Yeah,
tell your
okay.
complaints first. Okay.
And how old are you?
53.
No,
63. Okay. See, if there is a burning sensation
Yeah.
on one side of the body
Yeah.
and from head to toe,
Yeah.
one most important thing that we have to rule out in elderly people is whether there is a blood clot in the brain at a particular area which we call the thalamus. And I think if he has already consulted me, I would have asked for a CT scan. And if the CT scan is normal, we should actually go for an MRI. And even then, if we don't find anything like that, usually we treat such kind of pain with antidepressants.
Acha.
Because sometimes it may be of psychogenic origin also. But this gentleman can actually come back to us to GMC for a
Definitely.
re-evaluation.
Or means in short, like
Yeah.
तुम्ही न्यूरोलॉजिस्ट ओपिनियन घेवप गरजेचें आसा अशें दिसता. आनी जर तुमचें इन्व्हेस्टिगेशन, बेसिक इन्व्हेस्टिगेशन म्हणजे जशें सांगलें डॉक्टरान की सिटी स्कॅन, MRI केला, तो जर नॉर्मल आसा जाल्यार व्हडलेशें भिवपा सारकें काय आसना. केन्ना केन्ना स्ट्रेस किंवा टेन्शन सुद्दां अशा प्रकारचे फिलिंग्स क्रिएट करता. म्हाका दिसता जशें डॉक्टरान सांगलां, यू कॅन कंटिन्यू with your medication or you can take second opinion, and definitely there is a ray hope कारण जर तुमचे अशें डायग्नोसिस आणि डिटेक्शन जावना की अमको प्रॉब्लेम आसा जाल्यार डेफिनेटली देर आर चान्सीस ऑफ हीज
Yeah,
इम्प्रूव.
of course.
थोडेशे इवन तुमचे रिलॅक्सेशन टेक्निक जशे प्राणायाम, योगासना किंवा हे सुद्दां तुमकां हेल्प करू शकता. आय थिंक दॅट इज वन ऑफ द बेटर रेमेडी एंड हेल्प प्रॉपर ऑक्सिजनेशन ऑल्सो. सो डॉक्टर, यू सेड वन मोर इम्पॉर्टंट थिंग. इट इज मायग्रेन हेडेक इज मोर कॉमन अमॉंग द वुमन, अमॉंग द लेडी. Why this discrimination basically?
Actually, migraine, if you go into the pathophysiology of migraine,
Yeah.
it is because of the neurotransmitters. The neurotransmitters of the brain are not in a perfect balance when the migraine attack occurs. The brain is hypersensitive to certain stimuli.
अच्छा.
And that is how this migraine attack occurs. Estrogen, the female hormones, have an impact on those neurotransmitter balances, and that is why females suffer more from migraines.
Okay, so I'm just asking a little,
Yeah.
little twisted question. You mean to say more sensitive ladies are prone for getting migraine headache?
You could put it that way because stress
Acha.
is also one of the risk factors
yeah.
and it triggers for migraine.
Acha.
Okay,
So
if
I
there-
think that is the reason they often say that it is common among the intellectual women. I mean, I think those who are sensitive, they are more intelligent. So one way it is better, they should take it positively.
Yeah,
okay, I think we have got a question. Hello.
हॅलो
हा.
हॅलो
हा, विचारात.
हा डॉक्टर हांव पेडणेच्यान उलयतां.
हां
एक्चुअली म्हाका